The advice I'd give an MLA student their first time going out on practicum is that everything they teach you not to do and the things to watch for you will see out there, from the tourniquet being on far past your minute and not cleaning properly, no hand hygiene. You'll see it all, but to stick to what you've been taught and what you know is right and the SOPs and to follow them. To be punctual and on time, because that's noticed as well.
My advice would be, if you're disappointed with your practicum placement, to not be, because you've never been there before. So just listen to Julie and Camille, because they know where you would fit best.
My advice for you as an MLA student who's going on a practicum is to follow your SOPs, read it, know it by heart, because it's going to help you in so many ways. It will help you to perform your job well. It will help you to be great with your patients. I felt like Abes had equipped me with all the necessary information and everything that I needed to be a successful MLA. So I felt very confident when I was there. I had a great time doing my practicum. I knew my SOPs to the point where I just felt like I can actually argue with people that have been there for 10 years. So just know your SOPs, and whatever they teach you here at Abes just equips you with whatever you need. Abes is a great school, and listen to Mitch, and you know, I felt like the practicum was a great weight loss plan because I had lost weight walking around in the hospital. I just loved everything about my practicum, and I'm so happy that I did this course.
For me, number one, it would be attitude. I think you got to go in there and show the initiative that you out there to learn, and you got to be prepared to be there, I think, and everything else comes with the nature of the job. But initially, if you're eager to learn, if you go there with the right attitude, you'll do just fine.
Well, the biggest things that I found was making sure you arrive on time or early, and making sure that you're following the SOPs. Don't focus on the blood. Make sure that the patient is safe, that you're safe, and that everything procedurally is going well. If you miss, it's not the end of the world. Right? You've got the 2 pokes. You can always poke again. If you're not comfortable poking again, let your preceptor take over.
To be confident and to have the confidence in the skills that you learned here, for sure. Definitely. Because you are being sent out with fabulous skills, and as long as you keep that in your mind, you'll have the confidence to go through your practicum. It is a humbling job, really humbling. So if you think you're the best of the best, you're going to learn that you're not. So for sure, confidence. I don't think you should get your hopes up as to wanting to work where you're doing your practicum, because they do tell you you might not be placed here, but then they don't tell you that you won't either. So I think it's all in how you handle yourself and how you fit in with their group as well. Just like any job you would go to, your supervisors that are interviewing you, they want to know that you're going to fit in. I think it's just like anywhere else. So, and we got to learn skills that added on to the skills we had already got taught. So, yeah, got an offer. So I'm very stoked about that. Yes, definitely listen to Abes, Mitch, Julie, Camille, when they tell you not to get involved in gossip, because there are little cliques there, and there are groups, and one group will talk about another. And sometimes you're kind of stuck in the elevator so you can't walk away, but then there are times where you just kind of walk away and you do your thing and you do what you're there to do. And it's not worth forming an opinion or putting in an opinion. It wouldn't be to your benefit. So just be professional and don't listen, or just walk away and do something else, and no input.
Trust all of you guys, Julie, Camille, Joyce, Mitch, because they know you well. They know where to put you. They are very observant. They know how you work. They know what's going to suit you well, so just trust them. Because at the end of it, you're going to like it. So just be positive every time. Like, things get crazy, people get cranky. So just be positive, and like if you don't go well with like a person or a preceptor, just get through the day. Like you won't be with them the entire time, which I hope you really don't, because that would be a little, yeah, but just be positive, because at the end of the day you're going to be like, okay, I can take this, right? And if you have like, if you're feeling down and feeling negative about things, you tend to not do well, you tend to be a little shaky, you get more nervous, so just try to shake it off and be more positive. You will always make mistakes at some point. Even all the people that work there, they make mistakes. So just when you do, don't be afraid to admit that you made one. Take responsibility for it. Because when I did my practicum, I forgot to send my specimens down after 30 minutes, and it was like an hour ago already. So I just told my preceptor, I told her that I forgot, slipped out of my mind. So they got to fix it. They called them, said that I forgot to send it to them, and it's not lost, and it's on the way. So they got to fix it right away, instead of not telling them, and then they get to find out later, and then people get more mad when that happens because it goes so far back, and then yeah. So just tell them your mistake, admit it, and then take responsibility for it, and ask them what you can do about it.
Okay, so when a student goes out on practicum, I think it's important to remember that you are as a guest there to any practicum site that you go, and you might see things that are done incorrectly. Abes would have warned you of that. But then it's important that not to correct them. You just follow your procedures and do not correct anybody who is not following the procedures, because you don't want to create a negative impression. And secondly, I would like to tell them is the good attitude. Yeah, they need to be positive, because you might hear that there are no jobs in the field, but as you get closer to the end of your practicum, you'll get more and more positive. You will get a job. Like I have an interview on Monday, and it's the same practicum site that I have. So if you just work hard, create a good impression, have a positive attitude, you will end up getting a job.
I first of all would tell coming up students that your first day of practicum is going to be very scary, okay? But it gets better. You know, it's very nerve-wracking, but once you settle in, it's all good. You're going to be totally ready for it. Even like the first poke is very scary, but once you get over it, like it gets pretty routine really fast. It's important to get tough skin though, because some of the patients out there like can really like just walk all over you, be rude. They're not happy to be there, but don't take it personally. It's their own situation that they're being that way about. And also there's lots of stuff that is said out there about whether there's hiring or not, and I wouldn't listen to any of it, because nobody knows for sure except for the supervisors. Even your MLA too will tell you, like, I don't know, you know, the rules and hiring are all made from the top. And I just went about doing my practicum, and I've since had 2 job interviews.
If you were going to a hospital environment, my advice would be that you need to be both physically and emotionally prepared for what you are going to come up against. You also need to understand that when you're working in a hospital environment, you may have a few more safety issues that you have to deal with. Patients are probably a little more unpredictable, and you always have to be ready to deal with that situation. A hospital is also a large public area, so you always have to be aware of your personal surroundings. You do find yourself in a lot of isolated areas when you're traveling from ward to ward or what have you. Preceptors can be useful if they're a good preceptor or a poor preceptor. You can probably learn more from a poor preceptor because of your Abes training. You'll be able to quickly pick up on mistakes that they're making, and you'll see them being actively carried out with a patient, and it will just allow you to be a little more objective when you become a certified phlebotomist.
I would say to definitely do some research on your own before you go into practicum. The more knowledge you have, the more comfortable you're going to feel, that you cannot teach everything in 19 weeks. And the more information that you can pack into your backpack, the more work you're going to get done and more things that you can learn from your practicum. Second, I would say that to be above and beyond what you consider to be professionalism, because you are lowest on the totem pole, and the only way that you're going to show how good you are is to go above what you normally would do. So I think one of the reasons I was offered a position had nothing to do with my phlebotomy skills, is I was willing and able to listen to everything that was coming in. I could filter what was usable and what wasn't, and take it all in, and every one of my preceptors probably felt that I was, willing, able, and you're going to get misinformation, but that's up to you to decide when and where to use it, but just be present always and on time.
First thing, have self-confidence. You know what you're doing. They will never send you out there if you're not sure about what you're doing, your procedure, everything. And safety. Always focus on your safety and the patient's safety. Hand hygiene. Be on time, be punctual. That's a very important thing out there. Never sit down doing nothing. Even if there is nothing to do, just read your SOPs, practice on Millennium, or offer your help if they need it. That's it.
For the students, the one thing I would suggest them is don't be afraid of anything. Believe in yourself and always be ready to do whatever they want you to do. Because I was so nervous the day before I started my practicum, but I did very good on my first day and they were all impressed. So believe in yourself.
Well, you will be very nervous. That is completely normal. But along the days are going by, you will feel more confident when performing your phlebotomy skills. Stick to all the recommendations that are given by the instructors. Don't worry about getting blood. Just follow the proper procedures while maintaining safety. The preceptors will be there to help you. If you need any doubt, just clarify with them. Show positivism, good attitude. That will reflect a lot from you. In addition, I will say that this will be the best interview that you will have. So whatever is written in your resume, this is the perfect time to show that that is right.
A little bit. Some people that especially are a lot more old school or hadn't even attended school, it was on the job training, do things quite a bit different than what we're taught, which is, I guess, fine for them, but just, do it the right way, do it the way you were taught, and you'll be fine. I'd say go out there, listen to them, take advice well from them, respect them. They have been doing it a lot longer than you. If they do things that you don't agree with or whatever, just let it roll off you. Do it your way, do the way you were taught, and you'll get along fine.
Be open and willing to learn. The reason why is each and every person you come across will have something to teach you. You treat each and every person with respect and the way you want to be treated, and you'll have no problems. Everyone deserves respect. Each patient is different, and so is every person you come across. You'll learn from everybody you talk to.